Bipolar disorder. Bipolar disorder is a serious mental health condition that affects how a person feels, thinks, and behaves. It is marked by intense mood swings that range from emotional highs, called mania, to deep lows, known as depression. These changes go far beyond normal mood fluctuations and can disrupt work, relationships, and daily life. Understanding this condition in simple terms can help reduce stigma and encourage empathy toward those who live with it. When someone is in a manic episode, they may feel full of energy, excitement, and confidence. They might talk quickly, sleep very little, and believe they can accomplish anything. During this phase, people may start big projects, spend large amounts of money, or take risks they normally would not take. Everything seems positive at first, but the lack of control can lead to serious problems. Mania can also involve irritability, restlessness, and in severe cases, hallucinations or delusional thinking. On the opposite end of the spectrum is depression. In a depressive episode, the same person who was full of energy may now feel empty, hopeless, and unable to find joy in anything. They may lose motivation, have difficulty sleeping, or eat too much or too little. Simple tasks like getting out of bed or taking a shower can feel overwhelming. In severe cases, they may have thoughts about death or suicide. This contrast between mania and depression can be exhausting and confusing for both the person and their loved ones. There are a few types of bipolar disorder. Bipolar I disorder involves at least one full manic episode, often followed by depression. Bipolar II disorder features milder highs, known as hypomania, but longer and more painful depressive episodes. Cyclothymic disorder is a milder form with frequent mood swings that last for years. No matter the type, bipolar disorder requires long-term management and care to maintain stability. The causes of bipolar disorder are complex. Scientists believe it is linked to an imbalance in brain chemicals that control mood and emotion. Genetics also play a major role. People with a family history of bipolar disorder are more likely to develop it. However, environmental factors such as trauma, stress, or lack of sleep can also trigger episodes. This means that both biology and life experiences shape how the condition appears in each person. One of the biggest challenges of bipolar disorder is that it is often misunderstood. Some people think it is just about being moody, but that is far from the truth. These mood swings are not under the person's control, and they are much more intense and disruptive than normal emotional changes. Stigma and misinformation can make people afraid to seek help, which can worsen their condition over time. Society needs to replace judgment with understanding and support. Treatment for bipolar disorder usually combines medication, therapy, and healthy lifestyle changes. Mood stabilizers, antipsychotic medications, and sometimes antidepressants help regulate the brain's chemistry and prevent extreme mood episodes. It can take time to find the right combination, and stopping medication suddenly can cause relapse. This is why regular check-ins with a psychiatrist are essential. Therapy is another important part of treatment. Cognitive behavioral therapy helps individuals recognize negative thought patterns and replace them with balanced ones. Interpersonal and social rhythm therapy focuses on maintaining regular daily routines, such as consistent sleep and meal times, which reduce mood instability. Family therapy helps relatives understand the disorder and provide better support rather than criticism. Education and open communication make it easier to manage the condition. Lifestyle choices can make a big difference in stabilizing mood. A balanced diet, regular exercise, and proper sleep are all crucial. People with bipolar disorder should avoid drugs, alcohol, and excessive caffeine, as these can trigger mood swings. Stress management techniques like meditation, journaling, or yoga can also help calm the mind. Keeping a daily mood diary allows people to recognize early signs of mania or depression so they can act quickly to prevent a full episode. Living with bipolar disorder requires patience, self-awareness, and ongoing care. It can be discouraging when episodes return, but recovery is not about perfection. It is about stability and self-control. Many people with bipolar disorder go on to live fulfilling, creative, and productive lives. Some of the world's most admired artists, writers, and thinkers have lived with this condition and used their experiences to fuel their creativity and insight. Unfortunately, stigma still prevents many from seeking help. Mental illness is often treated differently from physical illness, even though both need professional attention. When people feel ashamed or misunderstood, they may hide their symptoms or stop treatment, which leads to more suffering. Spreading awareness helps normalize mental health discussions and encourages people to reach out for help early. Compassion and understanding can change lives. Family and friends play a vital role in the healing process. Supporting someone with bipolar disorder means being patient and learning the signs of mania and depression. During manic periods, gentle reminders to rest and take medication are helpful. During depressive phases, showing empathy and offering help with daily tasks can make a huge difference. The goal is not to fix the person but to walk beside them with love and understanding. People with bipolar disorder may sometimes stop their medication when they start feeling better, thinking they no longer need it. However, this can lead to relapse. Accepting that bipolar disorder is a lifelong condition helps maintain stability. Taking medication and attending therapy should be seen not as a burden but as an act of self-care. Over time, with the right treatment, many people can recognize their triggers and prevent full-blown episodes before they occur. It is also important to remember that having bipolar disorder does not define a person. It is only one part of who they are. With education, treatment, and support, people with this condition can achieve personal goals, maintain healthy relationships, and contribute meaningfully to society. When others approach them with kindness instead of judgment, recovery becomes easier and more sustainable. Bipolar disorder teaches society an important lesson that mental health is as real and vital as physical health. The ups and downs are not choices but symptoms of a condition that deserves care, not criticism. By raising awareness, we can help create a world where people with bipolar disorder feel safe to speak, seek help, and live with dignity. If you found this video informative, please like it and subscribe to the channel. Your support helps spread awareness about mental health and human behavior, encouraging understanding, compassion, and hope for everyone facing emotional challenges.